Now we're going to talk about the gastric sleeve procedure. Now the gastric sleeve is the most common weight loss surgery that I perform, and this is about 70 to 80% of the time is a procedure of choice for our patients. In a gastric sleeve procedure, we typically remove approximately 80% of the normal stomach, and there's 20% of the stomach that is left that is considered as the gastric sleeve. Some patients may think that we're inserting a sleeve or something that goes around their stomach, but that is not correct. There's no foreign body involved in the gastric sleeve procedure. We simply make your stomach into two parts. The smaller part, which is at 20%, is vertically oriented, connects the esophagus down to the intestine like a straight tube instead of being a wide sac, and the excess portion of the stomach, which is about 80%, is going to be sealed, cut, and removed. So the gastric sleeve procedure is a permanent procedure. In our practice, we offer the gastric sleeve procedure with two options. First, you can do it with the standard laparoscopic approach with 5 small keyhole type of incisions, and this is typically how it's performed in most of the other practices, and this is the standard approach. The second approach is the single incision umbilical approach, where we make a 1 incision at the belly button area and perform the entire surgery through this approach. The possible benefits of this approach include certainly a better cosmetic result from an incision healing standpoint, and possibly quicker recovery process. Some patients are candidates for the single incision procedure and some patients are not, and this is something that we would determine on the one-on-one consultation in the office. So how does the gastric sleeve actually work? The gastric sleeve, as you have heard, will create a smaller stomach, which is probably about 2 to 3 ounces in terms of volume capacity. So when you're going from a 30-ounce stomach to a 2 to 3 ounce stomach, there's a significant restriction for the amount of food that you can eat at one time, and therefore it reduces your portion size, it makes you full quicker, and it keeps you full for a longer period of time. So those are the benefits of getting a smaller stomach. However, the gastric sleeve does something more than that. Because we're removing the larger portion of the stomach tends to produce most of the hunger-producing hormone called ghrelin in the body. So when we remove this portion of the hunger, the ghrelin level is dramatically reduced, and therefore most patients become naturally much less hungry. The cravings for certain foods also go down, and therefore their mind is not on the food as much. When you have a smaller stomach, you're eating less and you're less hungry and you're not thinking about food as much, it becomes a lot more natural to continue the weight loss journey. There is an additional benefit for removing the larger portion of the stomach. The larger portion of the stomach tends to produce some of the chemicals and peptides that are not clearly identified or named yet, but these are going to get into the pancreas and some of the other metabolic areas of the body and inhibit the metabolic function. And therefore, removing the larger portion of the stomach, in addition to removing the hunger-producing hormone, the ghrelin, and giving you better hunger control, it also helps improve blood sugars, type 2 diabetes, and improves overall metabolic activity of the body. What are some of the benefits of the gastric sleeve procedure? Typical weight loss that we would expect with the gastric sleeve procedure, assuming patients are following their recommendations, is somewhere between 65 to 95% of the excess weight loss. What I mean by excess weight loss is if somebody is supposed to weigh 150 pounds, but their current weight is 250 pounds before the surgery, that means that they have 100 pounds of excess weight. So if they lost anywhere between 65 to 95 pounds of weight from the surgery, that means that they had a typical result. So this is an excellent weight loss result. Usually it takes about 12 months to accomplish this type of a result with the gastric sleeve procedure. The good news and the great news, in fact, with the gastric sleeve is that it has very minimal to almost no serious long-term complications. 90 days after the surgery, after full healing is complete, it is extremely uncommon that we would see any type of complications related to the gastric sleeve surgery.